On August 27th of this year, I took a group of visitors to a hospital that I used to work at in rural Haiti, central Haiti, in a town called La Colline. I hadn't been there in several years, although previously I had worked there for upwards of 6 years. And when the visitors and I arrived to the hospital, I was greeted by former patients and friends, and one of my former patients let me know that another colleague of mine, a patient, was hospitalized and not doing well. So, quick tour with the visitors, and then rushed over into the women's ward to see my former patient. When I got to the bedside, I was shocked. She was skeletal, a shadow of her former self. Eyes were sunken, could barely speak. Her mother was standing at the head of the bed. So I sat at the foot of the bed, and I tried to get a better understanding of what had happened to her over the last 2 years, because when I stopped caring for her and transitioned her care, she was a thriving young woman. She spoke slowly and deliberately, and we carried on a conversation for a few minutes. As we were talking, I was asking her questions. After about 3 or 4 minutes of our conversation, mid-sentence, she opened up her eyes very large, took a deep breath, and died. Her mother began screaming, was inconsolable, and I continued to sit at the foot of the bed, shocked at what I had just witnessed. All these months later, I continue to think about that day, and I think about my patient, Itana, and I think about why she died. But when I think about why she died, it's important to understand the context in which she lived. Itana was 30 years old, or thereabouts, and was born in a tiny, tiny village in central Haiti. In the 1980s, when she was born, she had a 12% chance of dying before the age of 1. 1 to 2 out of the people in her village, children, died before the age of 5. And were she to have lived, continued living, she could have expected to live to the age of 50. Only the age of 50. If you compare that to the metrics, say, in the United States, one of Haiti's closest neighbors, you realize that at that time in the 1980s, children born in the United States were 100 times less likely to die before the age of 5. And so, Itana was a survivor. When I first met her, she had HIV. We treated her for HIV. She did extremely well. She then contracted tuberculosis, almost died, bounced back. This photo is of her hooked up to an IV, dying of cholera. In fact, she was resuscitated and did quite well, and yet she still died. If you look at Haiti today, compared to 30 years ago, infant mortality, child mortality, maternal mortality have incrementally gotten a bit better. But that gap, the inequity between a place like Boston and a place like central Haiti remains this nearly unbridgeable chasm where, although the metrics have improved, say, child mortality, infant mortality, there's still, today, at the Brigham, say, or at the Mass General, kids are 100 times less likely to die in childbirth before the age of 1, before the age of 5. Really, choose any metric you want to, looking at health statistics in Haiti, and it occupies the bottom rung of the ladder of the countries in this hemisphere. It begs the question of why? Why is Haiti still like this? Especially when you look at the amount of foreign aid that has funneled to and through Haiti. Since 1980, the figure exceeds billions of dollars. It's billions upon billions of dollars. And yet, we find ourselves in this same quagmire, this same rut where people are dying of preventable disease. A woman like Itana dies a needless death. In fact, this chasm, this unbridgeable gap, seemingly, has been punctuated recently by two sentinel events. One, the cholera epidemic that has to date killed over 7,500 Haitians, infected over 600,000. A disease that selectively affects the poor. Because in fact, if you have access to clean, potable water and toilets, you are not going to, it's unlikely you will contract cholera. You're not at risk. The other sentinel event, the earthquake. The earthquake just changed the entire face of the country of Haiti. On January 12th, 2010, at around 4:50 in the afternoon, a 7.0 magnitude earthquake rocked Haiti to its core. In less than 60 seconds, there were 300,000 plus people who died. 1.6 million people left homeless, and hundreds of thousands of people fell ill, often died on the spot, but many more that were injured and tried to make it to the nearest hospital. The photo you see is of the Haitian White House, the equivalent of the White House, which crumbled during the earthquake, a metaphor for what happened to Haiti during that time. I happen to be in Boston. I'm a physician by training, and I happen to be in Boston where I spend part of my time. And on the day after the earthquake, flew down to Haiti. There is nothing in my life that could have prepared me for the horrors that I saw when I arrived to the primary place in which Partners in Health, the organization that I work with, focused our efforts, and that's in Port-au-Prince, in the General Hospital, the primary referral center for the public sector. In fact, the chaos that ensued in the first few days was exacerbated by people trying to help, it turns out. We arrived a couple days after, and then literally hour by hour, NGOs started pouring in. Name them, think of one, they were there. Haiti, parenthetically, had over 10,000 NGOs working in their country prior to the earthquake. And so you can imagine the number of NGOs that flooded in afterwards. What happened is pure chaos. The Haitian administration for this general hospital was still there. They were still trying to direct care, and yet NGO after NGO after NGO planted their flag, pitched their tent, and thought they knew better than everyone else. This photo illustrates, in fact, how this plays out, or at least played out over and over again, where you have a young woman carrying her mother with a broken leg, and you have people standing around. No one's even looking at her, looking to help her. And that is exactly what happened, trying to focus and really bring together all these disparate entities, some of whom had never worked in Haiti before, some of whom didn't understand the language, some of them whom didn't understand the culture, to try to come together to heal the thousands of patients that were in the courtyard of the hospital because the buildings were unsafe. If you drive through Haiti today, 2012, and you look around you, you would often wonder what happened, what's different. In some places, there's still rubble in the streets. Haiti looks similar to it did prior to the earthquake and actually immediately after. And so the common refrain, the question that keeps getting asked is, where did the money go? Where is it? I don't see anything different. And in fact, one of the most, I think, powerful things that I've, in my lifetime, is to understand the generosity of people like yourselves, people in the United States and others, after the earthquake, in which it was estimated by the State Department that up to 50% of U.S. households contributed to the Haiti recovery effort in some way. Billions of dollars went to Haiti, were pledged and went through Haiti. But let's, for a minute, just focus on a few of those billion, say. The UN Special Envoy's office is trying to do exactly that. Trace the money, where did it go, how it was spent, who received it, and what happened to it. And if you look at this graph, there are a few things that are absolutely striking. Number one, the same mechanism, the same NGOs that were running amok in Port-au-Prince, running amok everywhere else, received the lion's share of the funding. If you look at the other significant component of funding, in fact, it was military efforts like our own, say the United States, where I had naively thought actually that we were sending our military there as a gift, but in fact we were paying our own military to be there, and that came out of the money pledged to Haiti. And the other striking fact in this graph is that of those billions of dollars that went to Haiti in the humanitarian phase of the disaster, a mere 0.9% went to the Haitian public sector. Say what you will about the Haitian government, but in fact, we all know the role that the government should play in disasters. Sandy is a great example. Katrina is another example of our own federal government. And yet, we understand that the federal government of Haiti is weak and underfunded, but this exacerbates the problem when most of that money doesn't go to reinforce the government and their ability to respond to this epidemic, but circumvents them in a way that undermines their efforts. The recovery phase of the tragedy is still underway, and again, if you look at the figures, things have gotten a bit better in terms of distribution, but they still remain extremely skewed towards NGOs, etc. And so it just begs the question of, if you look around, if the way in which we are supporting Haiti and the aid, the billions of dollars that's flowing through Haiti, if this is what we can do, if this is the best that we can do, then is there a purpose? Or perhaps, is there a way in which we can do this better? Is there a way in which we can actually support the public sector, walk alongside them, ensure transparency and accountability, and yet have this money be productive in some way? And in fact, that's what the organization that I work with and the project that I'm working on is trying to do. We were asked by the government of Haiti, by the Minister of Health of Haiti, in March after the earthquake, to help them rebuild. This project of rebuilding that they had asked us to do was part of their 25-year strategic plan to do two things. Number one, to decentralize access to care for the Haitian people, and number two, decentralized medical and nursing education that had historically been concentrated in Port-au-Prince, the epicenter of the universe in Haiti. And so we set about discussing with the Ministry of Health, and a mere 5 months after the earthquake, we broke ground in a town called Mirebalais. We were asked to build it fast, to build it larger than we had ever anticipated, and build it to be a teaching hospital for Haitian residents, Haitian nursing students, and allied health professionals. And I'm happy to report that we are 99.9% complete with our construction efforts, and we hope to open our doors next year. If you think about the significance of this facility, there are a couple things that are important to understand. Number one, this will be squarely placed in the public sector. It's built by the people of Haiti, it's owned by the people of Haiti, and in fact, we will run it alongside the Haitian government. We've signed an MOU for at least 10 years of doing this together. We understand that the government may not have the resources, the personnel, or financial resources to be able to run this, and that's why we need to do this together. But it's not indefinite, because if we are setting up parallel systems, then what good are we years from now? Number two, imagine, if you will, that the Mass General Hospital or the Brigham and Women's Hospital or Beth Israel Deaconess was the only teaching hospital on the East Coast. And in fact, therein lies the tragedy that is the infrastructure and the failure of some of the failure of the Haitian system of education. There are just too few structures, too few schools. And so this is an effort as part of their plan to really bolster the educational efforts. This will be the most advanced hospital in Haiti, private or public. 6 operating rooms. An intensive care unit for children, an intensive care unit for adults, an intensive care unit for neonates, an endoscopy suite. Again, things that we find commonplace less than a mile from here, but in Haiti, these innovative efforts are unprecedented. The photo is of the children's ward, and we actually, in our effort to make the hospital a beautiful place, collaborated with a United States mosaic artist, a leader in her field named Laurel True, to beautify the hospital. And in fact, happy to report that the children's ward, of the places that are beautiful in the hospital, the children's ward is standout in its ability to just shine and also provide a dignified space for patients. This hospital was built at the end of the day, we tally our books, was built for $80 per square foot. What's the total square footage? 205,000 square feet, $80 per square foot. It was built by Haitians, and it was also built with the local unions. An incredible combination of people coming together to do this. When I think about the question of why Itana died, not the pathophysiological reasons why she died, but in fact, at the end of the day, why she died because of the failure of aid, it turns out. She died because she didn't have access to a ventilator to help her breathe when she couldn't breathe on her own. She didn't have access to life-saving antibiotics to treat her infection. She didn't have access to life-saving medications to raise her blood pressure when her blood pressure started to plummet. And that is what we are trying to do here, create a new paradigm for healthcare delivery. You could argue that Haiti doesn't need that. Haiti needs more primary care facilities. Haiti needs more places to vaccinate children. Haiti needs more focus on potable water and sewage. And in fact, I would say you are correct. These efforts are not mutually exclusive. What we are able to do for our patients, the fundamentals of medicine, do not change when you leave the Boston area and get on a plane and fly to Haiti. And that's what we are trying to do. And that is the way in which aid should be spent. Meaning, the priorities that we are undertaking are the priorities of the Haitian people and the Haitian government. And we are working with the Haitian government to reinforce their ability to do what they cannot do today and what they need to be doing in the future. If aid is done that way, if we are able to funnel aid to Haiti in a way that reinforces the government, that reinforces their ability to respond to epidemics, to respond to tragedies in a transparent and accountable way, then we will finally be on the right track. Thanks very much.